Good afternoon. My name is Jennifer Hutchins. I'm the Executive Director of the Maine Association of Nonprofits. I use she, her pronouns, and I'm a woman in her 50s with light skin, mid-length brown hair. I'm wearing glasses and a maroon cardigan today. Thank you so much for joining us. We're so pleased to have the chance to share with you a new program that we're launching that's designed to support Maine people with purpose. And for us, that means the employees of our state's charitable nonprofits. Because nonprofits are what? They are the invisible backbone of our communities, providing critical support to improve our communities, promote health and well-being, and in many cases, save lives. Every day, we hear from members who are facing, unfortunately, increasing demands for their services while the resources are increasingly limited and under strain. These urgent challenges that our nonprofits are facing are taking a serious toll on staff. And when nonprofit employees are burned out, everyone in Maine communities feels the impact. The Employee Assistance Program that we will introduce to you today is one way that we have the opportunity to care for the people who care for Maine. I'm really excited about this. This new member benefit leverages our amazing network, including all of you, to create an economy of scale that's needed for small nonprofits to access professional, confidential support for staff. You're going to hear about services like counseling for managing stress, burnout, or grief, navigating parental challenges, help finding elder care services, and much more. I personally was just astounded by all the services that our partners will be able to offer through this program. We're so excited for you to learn more about how it works today with us. But before we move on, I want to say this would absolutely never have been possible without the partnership, leadership, and support of the Maine Community Foundation, particularly our dear colleague, Laura Lee, the Foundation's Vice President of Community Impact, who I am going to now invite to say a few words as we get started. Hi, Laura.
Thank you so much, Jen. As Jen said, my name is Laura Lee. I use she, her pronouns, and I'm in my mid-50s, woman, dark black hair, wire rim glasses, and a patterned sweater. I serve as the Vice President of Community Impact at the Maine Community Foundation. We are a statewide community foundation, and we bring people and resources together to build a vibrant and equitable Maine. I'm also honored to serve on the board of directors of MANP, and so was hearing, as Jen said, how challenging it has become for nonprofits to operate in such an uncertain and constantly changing environment. So when we heard about the Employee Assistance Program pilot being launched by our friends in New Hampshire, we were eager to learn about it and quickly talk to MAMP as a perfect partner to try this out in Maine. We are hoping that this program will raise awareness about the services available through an EAP benefit, as well as provide direct support to those of you in small nonprofits who might not have access to these types of benefits already. So I just want to say a big thank you to MAMP for taking this on, to KGA for creating a way for these benefits to be accessed by smaller organizations, and thank you to all of you who are attending today and just taking the time to learn about this program and take a step towards getting the help and assistance that you and your employees and coworkers and family members might need. So thanks. I'll turn it back to Jen.
Thank you so much, Laura. Hopefully you're seeing a slide up today. Before I turn it over to our partners at KGA, I wanted to just briefly review the eligibility requirements that we have on our website and in preparation for today's program. This program is, as Laura started to outline, but more specifically, this is for MAMP member organizations. We do have assistance if you aren't already a member and you're concerned about how you might be able to afford to be part of our member network. We do have assistance available to you. located in Maine, fewer than 10 staff members, and do not currently have access to an employee assistance program or an EAP, which is something you'll probably hear, an acronym you might hear several times. So just a quick reminder about that. And with that, I'm going to turn it over to our partner, Nicole Sawit from KGA to talk more specifically about the EAP program. Nicole?
Yes, hi. Hi, everyone. My name is Nicole Sawitz. Thank you, Jen, for introducing me. I am going to be introducing myself, then I'm going to turn it over to my colleague, Megan Peavy, and then I will be taking the reins back from her at the end of the presentation. But I did want to introduce myself really quickly. My name is Nicole Sawitz. I use the pronouns she, her, hers. I have brown hair, brown eyes, light-skinned woman in my early 40s who is wearing a green knit dress and silver earrings. I am an account manager with KGA and have been with the organization since 2022. I've been in the employee benefits space for the last 10 years, and I live with my spouse, an energetic cat, in Worcester, Massachusetts. But I do love visiting Maine, especially Portland, and I've been as far north as Caribou, Maine. I believe everyone should have access to mental health support through their employer, no matter the size of their organization, especially for the people in the nonprofit sector who take on so much. And with that, I will turn it over to Megan Peavy.
Thank you so much, Nicole. My name is Megan Peavy, and I use the pronouns she, her, hers. I am an adult female in my mid 30s, blondish brown hair, Caucasian, and I'm wearing a blue turtleneck sweater today. Thank you so much for having me. I work in the business development space here at KGA, and I also manage our implementation. So it's been a pleasure onboarding MANP, with, of course, handing it off to Nicole for account management support. I live in New Hampshire, so I'm just a hop, skipping away from Maine. And I live here with my husband and our two children. So I have used these services professionally and personally. I've been with the company for almost 11 years. So if you do have questions, please feel free to use the chat. Nicole will answer those. And if there's anything specific that I've done for work, when Nicole's presenting, I can go back and answer those for you. So we're going to get started here and just kind of highlight the services that are available. We're going to go through these in more depth throughout this presentation. But as Jen was sharing, we do provide support for emotional and mental health, family, home, and work. We also offer well-being services and, of course, support for supervisors and managers. Some basic information on KGA to keep in mind is that we are available to the employee, but also to any adult household members. This could be a roommate, a spouse, collegiate age child living at UVM that accesses us for services. We are available. It does not need to be a marriage or anything like that for someone to have access to services. We are also completely confidential. So confidentiality is at the crux of what we offer and practice. The only time we break confidentiality is, of course, if someone's safety were to be a concern. Additionally, we are available 24/7, so you can always contact us and speak with a counselor for live in the moment support. In addition to that live support, we do have digital access. So you can access us on your phone, on the internet. We have a platform. All of that is available and accessible to you and your adult household members. We pride ourselves on the speed and alignment of the support that we provide, which I will get into more detail in the emotional mental health space. And the most important thing to keep in mind is that our services are at no cost to you. So this is something that is free and available to you and your adult household members. Lastly, just some background information on KGA. We've been doing this since the 80s. So I personally have not. I was not born yet then. But we have been providing services since 1982. We primarily serve and sell into New England, but we are available nationwide and in Canada. Currently, we serve over 375 clients, and we are a completely independent provider. All right, so we're going to get started talking about our emotional and mental health support. And some things that we offer here at KGA are counseling and coaching. So we do offer that in the moment support 24/7. You could be on your way to work, having a panic attack, and wanting to talk to a counselor. That is completely included and unlimited. What you would be able to do as well is talk to that person in the moment. And if you wanted to continue on, you can do so with a 3-session model. What this means is you have access to 3 free counseling sessions per issue. So you talk to that counselor about your anxiety and your panic, and they share with you, it sounds like working with somebody for shorter term support might be useful for you. So you would meet with one of our KGA counselors virtually for those 3 free sessions. Now, if you call and you get in the moment support and you just need coaching around a situation, that is available as well. Again, completely unlimited and available 24/7. Now, if you need something that's maybe more in depth than the 3 sessions per issue, what we can do is we assess those situations to help determine what next steps are clinically appropriate for you. We are making this match for you. So if you reach out to us sharing, I want an LGBTQ allied clinician that can see me through my Anthem Blue Cross Blue Shield insurance and can speak Spanish, we can do that search for you. So if you do need longer term care, we can, of course, honor the 3 sessions per issue with an affiliated clinician of ours that might be in your community, in the state of Maine, wherever that might be that you need to talk to them and make that match for you so that you can see them for your sessions and then continue through your health insurance after the fact. So seamless support. It's important to keep in mind that you will never be searching for availability, whether it is for mental and emotional health support or you need help finding a house cleaner, which we'll get into. You are never searching for availability. That's what we are doing. And we normalize that it's okay to not know what you want. That's what our counseling team is here for. Now, I know you are nonprofit organizations, and sometimes you don't get insurance through your organization. Or maybe you have a roommate who is uninsured and they want to access our services. We additionally offer support through Talkspace and BetterHelp. We've partnered with these organizations so that you can use your session model and then you can continue with them with an option that's more affordable than an out-of-pocket expense with a standard clinician. So just another option to make note of. Additionally, we offer peer support here at KGA. This actually is changing to 12 free group sessions. So you can pick 12 of the same. You can mix and match. These are available through either our counselors at KGA that offer these, or we do have a partnership with Hey Peers, which is a certified peer specialist that is running the group instead of a licensed clinician. So going back to this term blended mental health solutions, what it means is it's not a one size fits all model. Some people reach out to us and they want counseling support, but they also want to do support groups. And they might also want something like a self-assessment on our platform. They might want to use all of these things at once, and that's absolutely fine. But we also have these options so that if you don't want to use counseling and you'd rather read a book or you'd rather attend a webinar to learn about a topic that's of interest, that's available too. So you do not need to use traditional cognitive behavioral therapy counseling. You can use all these different options. And then something that I haven't covered yet on this slide, just to make note of, is although we do provide services to individuals that are 18 and older, we help families all the time with locating counselors for their minors. So if you do need a counselor for your child or your adolescent, they can't call us and use the sessions, but we can help you as the parent or guardian locate resources within your health insurance that are accepting new clients. So again, we're doing that outreach on your behalf. But to move back to this digital self-directed tools that we offer, we do have the self-assessments. We have a mindfulness challenge, monthly free webinars. We have a bookshelf that you can look through and order on Amazon, all different types of resources. We also have what we call MindTide. This is a digital cognitive behavioral therapy app. This app is like having a counselor in your pocket, and it is completely free on the App Store and Google Play. So it really helps with anxious thoughts, catastrophizing thoughts, panic, difficulty sleeping, with techniques like body scanning and deep breathing. So this is completely free and available as well. We're going to switch gears here into the family, home, and work side of things. So do we have any questions regarding mental and emotional health support? And just to highlight what I was sharing by per issue, what that means is if I reached out to KGA for grief counseling in January, and then in March, I reach out for anxiety support, both of those times I would have access to 3 free counseling sessions as they are 2 separate issues. All right. So when we talk about family, home, and work solutions, what we mean is we provide support with parents trying to locate childcare, or if you're that sandwich generation in need of elder care, and help with college planning. There's all these different areas that we can help with. Again, also including legal, financial, convenience services, health and nutrition, etc. So we're going to go through these in more depth in just a moment. But what we have here at KGA are work-life consultants. So we have our counseling team that you can call and talk to for support, but we also have our family, home, and work team. You can talk to our work-life consultants at any time about childcare, elder care, whatever it might be. It's when you are getting referred to a subject matter expert, like an attorney, like a nutritionist, or a sleep coach. That's when it's a free 30-minute consultation per issue. And additionally, what we can do is customized research for you. So I'll get into that in just a moment. But the reason we're making these outbound calls, whether it's for counseling services or childcare providers, is to make sure it's a legitimate resource, they have availability, and you're not going to get a dead end when you reach out. So we're going to start here with caregiver support. So as you can see, we have the parenting side of things, and we also have the elder care. So as I've mentioned, if you call and you're looking for childcare in Maine and you want different towns for us to look into, that's absolutely something we can do. You don't have a 30-minute consult. You can call at any time for that. So what our team will do is they will use the early education childcare website for your state to ensure that we're calling licensed centers. We will take into consideration the age of your child when they need care, your preferred budget, your preferred location, and we also gather information like when tours are provided. Do they provide meals? Do I need to pack diapers, etc. So we do all that research for you. Additionally, we do that for things like summer camps. But we also do have a lot of great experts available for that referral process. So you can talk to, again, for a free 30-minute consultation, our early childhood development specialist, or a fertility coach, or our special education consultant. As I mentioned, I am a mom of 2. So if I have other parents on the call with me, I think we can collectively agree that a 30-minute consultation with a parent coach is not going to be substantial enough. So our parent coach is the only expert that will actually meet with you for your 3 free 50-minute sessions. So it's a really great way to kind of come up with a plan and execute that plan. Additionally, we have people that reach out to us looking for counseling support for a 3-year-old, where the 3-year-old might not need counseling support. It might be the parent that needs some coaching around that situation. So That is available. And on the contrary, over here we have elder care support. So we do the same kind of searching as we do for childcare, for assisted living facilities, home health companions, home health aides, skilled nursing homes, etc. We also do have a KGA staff member who is an elder care specialist. And you can reach out, talk with this person about certain concerns and difficult conversations like, how do I tell my loved one they can't drive anymore? Or what level of care does my aging parent need? So that is available.
If I can interject real quick, Megan, sorry,
Yeah.
just to add, when it comes to the elder care, your elder loved one does not need to live in the state of Maine. If you're caring for a loved one across the country, we can assist as well. So just keep that in mind. It doesn't need to be local to Maine or even New England.
Thank you so much for that, Nicole. Very, very true. And that stands true for the elder care support, but it can also stand true for childcare or mental health support. So anything like that, they don't necessarily need to be living in the state of Maine. We have people that reach out to us on behalf of an aging parent in Florida, Arizona, all the time. It's something we can absolutely assist with. Switching gears to the legal and financial side of things, what we offer are the free 30-minute consultation per issue. So typically we have people reach out to us for legal support regarding divorce, child custody, estate planning, landlord-tenant issues, etc. So they have that free consult. We do have a national network of attorneys. Our in-state attorneys are Massachusetts. So unless you were vacationing on Cape Cod and you got a speeding ticket and you want to talk to one of our in-state attorneys in Massachusetts, you can absolutely do so. Otherwise, we have that national network available for you. We also have financial consultations available. Again, one free 30-minute consult per issue. So if you reach out to us, it is the season after all for tax assistance. We have CPAs available for free consultation. If you need an affordable option, so you want help finding an H&R block in your neighborhood, that's something we can help with too. We would do a search for you for that. But additionally, things like budgeting, debt management, home buying, etc., are very regular reasons why people reach out to us for financial support. Actually, I'm going to go back for 1 second and just throw in a little disclaimer that for legal support, the only area we do not help with is employment related concerns. So if you want to sue your employer or anything like that, that's not an area that we can help you with, but we can help you with things like work stress. So we do have our KGA counselors that can help you completely confidentially with any work stress or need like that. But we also have career coaches available. Just like with legal, if you want to go after your employer, we can't coach you on leaving your job, but we can, of course, assist with things like if you're looking to apply internally at your job for a different position, or you have that collegiate age child who reaches out to us, not sure what to do with their degree when they graduate. This is a great place to start. We also do have that support for loved ones that are in between jobs. So maybe your roommate is in between jobs and not sure where to turn. This is a great resource to help with resume revamping and so on. This is my absolute favorite slide in this entire deck because who would associate an EAP with providing this type of support? This is something we see all the time, and I love to educate people on this support. So things like locating a roofer, a dog walker, dog boarding services, a pediatrician, a new dentist, a chiropractor, a gym class. I helped somebody board their pet hedgehog one time when they were going on vacation. These are things that we help you locate. So again, we're making those outbound calls. So we know that that number works. We know this person serves your area, and we know that they are available to assist you. So this is something to just keep in mind, but really anything you can think of, we can assist with. And then lastly, here we do have support in the realm of health. So we do offer free consultations with nutritionists. We also have a sleep coach and we have a lactation consultant as well. So our dietitian can work with parents and guardians on picky eaters for children, but they also can help with things like eating for certain diagnoses. Only if you are taking care of that diagnosis, if you do have diabetes and you're not taking care of that, then that would be something we'd more so connect you to a counselor or get you a referral to a specialist. But we also have our sleep coach that's really great around, um, you know, insomnia or difficulty falling asleep or difficulty staying asleep. So, really great resources that are available. And again, free consultations. So, this last slide here kind of goes back to when Nicole was sharing about helping in other states. But when we have a case come in, so you're reaching out to us with a concern, oftentimes we see that that one concern has so many other layers to it. So in this situation with Maria, she's calling in because her mother has dementia and she needs resources. So, what you're not necessarily expecting is that it's going to turn into these other areas of support. So, yes, we do provide her with that elder care consultation where we are going to put out a search to locate 3 in-home care referrals in Cincinnati, because that might not be where the employee lives, but that's where mom lives. But we're also getting I'm sorry, not mom. We're also getting the employee a counselor. They are grieving what their mother was, and they need support as they navigate this. So we're getting them a counselor, and then we're also getting them connected to an attorney in the state of Ohio to help identify and put in place that healthcare proxy. So even though it's just a case, we help with so many different layers in that one phone call. So this is where I am going to turn it over to Nicole. So I am going to stop sharing my screen and I am going to take over in the chat feature.
Okay, so hopefully everyone's seeing my screen now. Yes, no, we good? Okay,
Yes,
good.
good.
Okay, so,
Yeah.
sorry. I just wanted to make sure. All right, so I am switching gears a little bit. Thank you, Megan, for all that helpful information about our employee services. So those were kind of focused on the employee level services, but KGA also has services here to support managers and supervisors, people who are managing and supporting their employees. So we know this is not an easy task. It's not an easy job, and oftentimes people aren't really given the training to manage people. It's, people are just told you're going to be the manager and off they go. But it is a skill to develop, and we're here to help people develop that skill and help people to navigate the challenges that come up when you are a manager. So we have what we call manager consults. So this is when you're having an issue, concerns with someone's well-being or concerns with some behavioral issues. Someone's returning to work and how to kind of ease them into that return to work.
Nicole,
Navigate. Yes.
I'm so sorry to interrupt
Yeah.
you, but there was a question if you can put it into the slideshow
Sure.
so that we
Yes.
can see.
Just noticed that. Yep.
Thank you.
Of course. Hopefully that's better. Oh, sorry. I don't know why it took me out of that, but we're gonna get back there. Sorry for making anyone dizzy. Okay, we're back. Thank you. So manager consults. We're here to help you navigate challenges, navigate conflict. Now, we won't provide mediation. Like if you have 2 employees that are, bickering and not getting along, we're not going to come in and mediate that, but we will help the managers and provide tools for the managers to help mitigate the circumstances, to help resolve the circumstances, to help figure out how the next best steps there. So, and also we can help and a manager make a referral to KGA, actually getting that employee into KGA to start using the services that Megan just spoke about before. So getting them into some mental health counseling or getting them connected with a parent coach, all those kind of things. So if a manager is seeing some issues or some red flags go up with an employee, they can reach out to us. And this is an unlimited service. You have unlimited amount of manager consults available to you through this program. We can also help you make mandated referrals. So mandated referrals would be like basically they would be mandated, required to reach out to us. We have a whole process in place if that's something you're looking to do with an employee. There are some procedures and processes to go through, but it is something we can assist with. And then we have a manager learning section of our platform that has a lot of tutorials, information, trainings, specifically geared towards managers. And we have our bookshelf that has books geared towards managers as well. So that is our support for managers. Any questions before I move on to the crisis response about managers? Okay. So switching gears yet again, now I'm going to talk about our crisis response. My hope is you will never have to use this, but should a crisis come up in your organization, we can help support you. KGA can at least. We can help support individuals, organizations, and teams and major events. So what's most common we see is, an employee passing away and people trying to navigate that grief and the shock and go and navigating that circumstances. So we can provide counselors on site to help you with those challenges that might come up, consultations for risk assessment, leadership decisions, on-site response, follow-up activities. That's what you're going to get when you have that crisis outreach from us. So in order to get that crisis, if it should come up, the best way to get that support is to call the 800 number. So there are a number of allotted hours for MANP as an entity, and we would work with MANP to get those hours communicated, and we would be able to support you. So just know that we do have crisis support available to you should the need come up. Hopefully it never does, but the 800 number is the best way to get in touch. And you would say, I'm part of MANF, and then we would be able to assist you from there. It's available 24 hours a day, 7 days a week, and it's a team-based response. So you wouldn't be working with just one person. The counselor would loop me in, other people would get involved. You get that whole team-based response from reaching out to that 800 number. So just keep that in mind. And the 800 number is the best way to do that in the case of emergency. Any questions about that? So we have a number of different ways to get in touch with us. You can call the 800 number 24 hours a day, 7 days a week. You can schedule an appointment with us online. That's kind of like using Open Table. If you've ever made dining reservations, you can do that. You can even have us call you. So if it's during business hours and you just don't feel like picking up the phone, there's a button that will illuminate on our platform. It'll ask you your phone number, and then we will give you a call back within the hour. We have our platform, which I'm going to take you out to very shortly, that is my.kgalifeservices.com. And then we also have our mobile app. So you can download the app. It's if you go to the Google Play Store or the Apple Store and look for the KGA logo, which is in the top right-hand corner here, you can download the app, which basically mimics the website, the platform. This is different than the MindTide. So MindTide is an app that you would use to help fight negative thinking and anxiety. And the KGA mobile app is a different app that you would use to mimic the platform. So that's basically the website. So there are two different apps, just so people don't get confused. Any questions before I switch gears again and show you the platform? Let me just share my screen again.
There was a question regarding support for domestic abuse, sexual assault support. We do offer support regarding those types of issues. We do have, which Nicole can show you, a specific spot on our page. Oftentimes we do have managers reaching out to us looking for resources on behalf of that employee. We encourage that manager to have the employee contact us directly. But we do have a bunch of resources available specifically to partner violence. So I'll let Nicole share that.
Perfect. Yeah. So before I dive into, setting up your account on the platform, I do want to just show in the case of, domestic violence, if there are situations, we do have this quick exit button. So we know that if someone's on here looking and they don't want someone to know that they're looking, we have put this quick exit button on all of our pages. So that quickly takes you right back out to the Google, the Google, the Google search Google. So just wanted to make people aware of that. But I'm going to take a step back here and show you how you can create an account. So you can create an account. Anyone in your adult household, any one of your adult household members can also create their own account. They would do this the exact same way. So when it comes to you're setting this up, you're going to hit this Get Started button down here at the bottom. You also want to point your attention to this video. If you need to review any of the information basically that we talked about today, this is a great place to watch. It gives you a short tutorial, 3 minutes quick, but it just kind of highlights the top points again if you need a refresher. So you're going to hit the Get Started button. And then what you're going to do is you're going to type in your organization, which is Maine Association of Nonprofits. It will be inactive right now because this doesn't officially launch until March 1. So once March 1 happens, you will be able to use this code. It won't say inactive anymore is what I'm trying to say. So you can set up your account officially. Your first name, your last name, and email address. It doesn't have to be a work email address. Actually, we recommend a personal email address just to keep things separate, from your work. Because sometimes we'll put appointments on your calendar. If you schedule with us, and an appointment would go onto your calendar. So if you use a personal email, it's going to go onto your personal calendar rather than your work. So if you do use a work one, just know that appointments could get scheduled there. Just for confidentiality reasons, we like to let people know. And then a phone number if you want, and a password of your choosing, and then hit Become a Member. I need help signing up. If you have any issues, you run into trouble, anything getting in, this button is your friend. Hit that, and you'll be able to get in touch with our IT team. But once you're in, and it's March 1, and you've come here, you've set up your account, this is what you're going to see. So you'll see we have 3 different tiles here. We have the emotional mental health side with family, home, and work, and then we have managers and supervisors. So we kind of have divided things into those 3 different categories, and this is where you can come to get those resources. But I do want to direct your attention to the left-hand side here. While we were on the topic, we do have a partner violence support tab right here. So it's right under service options, easily accessible to get to that information. Also under the service option is MindTide. So I know that Megan spoke about the MindTide app. The very first time that you use MindTide is going to ask you for a token. It's basically an access code. So you come here, go to MindTide. Oops, let me just log in. And this token is right here on the right-hand side. Click that token, enter it into your cell phone. Again, this is only for the very first time that you use MindTide. Going forward, you will not need the token. And each individual adult household member can access their own token. So they would set up the account the exact same way that you have, and then get their own token. So that is how you can access MindTide. We have our peer support groups that Megan mentioned. These are available right online. Here's where you can go and take a look at what we offer. We offer ones that are specifically for KGA clients, and then we offer ones that are through our partner, Hey Peer. So there are different options, different availability. The schedule is right here. If you can browse the calendar right here and take a look at the times and register them right here, then and there. So those are available, those peer support groups, and you don't need to talk to anyone on the phone or pick up any, it's just right from this platform, you'd get that information that you need, and you can join the group. Also under service options are there self-screeners that Megan mentioned. These are the self-screeners. There are 10 short questions on a variety of different topics. And again, these are completely confidential. So if you were to complete one of these, no one would know. And you can take these as many times as you want, but these are all available and easily accessible to take the assessments. Under the Learn option here, you'll see that we have our wellness calendar. So every month we choose a particular topic and highlight that topic with a wellness webinar. And January, we did Finding Belonging. That webinar already took place in January. But let me scroll down to March since that's when you'll be able to access all this. Equity in Action is happening at the beginning of March. That's happening on March 4th. You can register for that and attend that live. If for whatever reason you can't attend live, we do record them and they are posted here. So you can go back and record them, watch the recording on your own time. I do recommend that you register for these. It's never too early to register for them. And if you register and then don't attend for whatever reason, something comes up, you'll get a little reminder email afterwards about the recording. So it's great to just keep that on your radar. It's a great way to keep it on your radar and where you don't have to do anything. So if any of these topics look interesting to you, we have all of 2026 already planned out. Please come and register for those. We're highlighting a number of different topics, everything from journey to family. So that's a kind of modern family formation, fertility, everything from that to in caregiver support and understanding mobility, reclaiming wonder and joy. So these are some topics that we're covering. Also under Learn is our bookshelf. So you'll see this KGA bookshelf. We have divided things up into different topics: diversity, equity, inclusion, emotional and mental health. And I'll scroll down, nutrition, parenting and caregivers, sleep, substance abuse. So a lot of different topics. And these have been vetted by our staff here at KGA. And so these come recommended. So it's a great place to look for recommendations. Also under Learn, we have our online trainings. So I did mention the trainings for managers. This is available to managers. So we have one specifically for managers. We have workplace essentials, personal developments, and teams. So these trainings are available at no cost through KGA. And if you were to assign one of these personal development or workplace essentials, I'll click into it. Let's say you were trying to assign one of these courses, the change management or business etiquette. You can assign it in the sense that you can ask your employees to provide a certificate of completion at the end. So they're going to get through the 12 modules of this course, and at the end they would get that certificate completion, which they would provide to you as proof that they completed it. So that's the way that we would would know. That's the way you would know that they've actually completed the course, is through that certificate that they would get at the end. So that is available to you. And we also finally have our meditation challenge, a meditation podcast. So these are wonderful podcasts. I've used them myself. They're really relaxing. I particularly like this safe split place imagery one, which is really great. 5 minutes. The speaker is really, really nice, really, really soothing. And then also finally our mindfulness challenge, which I believe Megan spoke about, but this is just a 30-day challenge to help you stay accountable to your mindfulness. We're not gonna check in and make sure you're doing it. It's completely confidential. We're not gonna scold you if you don't do it. It's just a way to stay self-accountable to your mindfulness, especially in the new year when people might be looking to explore that and freshen up their mindfulness. And then lastly, I promise, I keep saying lastly, but this is it. I want to point your attention to this Get Support Now button at the top. Get Support Now. We have a number of different ways to access KGA, everything from call us, schedule an appointment that I mentioned. So that's where you would do all those things: call now, schedule, ask us to call you. But we also have this Get Started Online. So basically you can start the process online for anyone who isn't looking to pick up the phone and call. This is a great option. I would not use this in a case of emergency, but maybe you're looking for some childcare resources. It's 10 o'clock at night. It dawns on you like, oh, I'd love to reach out to KGA and get some resources. This is a great place to get started. 5-10 minutes, and it'll get the process started for you right online. So it's really simple, really easy, user-friendly, and it's a pretty new product that we just rolled out about 6 months ago, and it's been really well received.
And there have been some questions
Okay.
regarding confidentiality and sensitivity of information.
Mhm.
All of our services, as I've mentioned, are confidential, and everything on our platform is completely confidential and anonymous as well. So while MANP might get a report that's showing how many times the substance misuse screening was taken, they don't know who it is tied to. So, that's something to just keep in mind. So everything's confidential. We encourage members to use their personal emails if they want to. Again, the only time that confidentiality is broken is if safety were to be a concern. So I just wanted to point that out. And it does say 100% confidential on just about every page of our platform, if not. And yes, we absolutely support other languages. We do have an accessibility widget on our platform that helps offer screen reading, a little different viewing tool for people that have ADHD. You can change the font size, color, spacing, etc. But we do have the ability to translate our platform into, I think, about 18 languages is up there right now, something like that. If you don't see one that you need, please let us know. Additionally, we have KGA staff members that speak other languages, and we do have something called the language line. When you do request a call, which is one of those access points on our platform, you can note that you would like an interpreter. So that is something that is available. Yes, we have counselors of all identities. We have tons of BIPOC, LGBTQ identified, LGBTQ allied. We have an affiliate relations team that is constantly working on diversifying that network. And again, our main requirement is that they accept at least one insurance so that you can continue to see them without that out-of-pocket expense. I'm just checking if there's any other questions that I can answer.
Yeah, and Megan, I was also going to invite our staff. Are there any questions in chat, Molly or Ellis, that you think we should either re-clarify or anything that we haven't covered so far?
We have a couple of questions we're going to follow up with people with after the session, but at the moment, I think we're okay.
Okay, great. You guys have been doing a great job keeping up with the various questions. We do have some more time, so don't hesitate to continue with questions that you might have for Megan or Nicole.
Yeah, and they don't
Is
have to
there
be in the
any?
chat. If you want to take yourself off mute, if it's easier to ask it verbally than written, that's fine too. So feel free.
Okay,
Yeah.
okay.
And I did see a question regarding KGA smaller business solution. So we do also offer that. So if you do not qualify to enroll in this program, we do offer support for smaller organizations at a more affordable option. So that's always something we're happy to talk about too.
Yeah, and we do have some folks asking. Right now, we have space for up to 300 employees. And so, but again, emphasizing this is a pilot, we're very interested in seeing about demand and how this program goes. And we are very interested in the possibility of expanding it. But at the moment, we're going to limit it to 300 employees. Actually, Ellis, would you like to come off mute and answer that question about membership dues and scholarships?
Yeah, so this program is free to members of MANP, and if your organization is not already a member of MANP, we can work with you to get you enrolled. That's something that we could chat with you about offline. I would say if you're interested, go ahead and sign up and then reach out to us and we can get you set up. And so the scholarship that you saw was probably in reference to becoming a member of MAMP. And again, that's something that we can chat with organizations about on a case-by-case basis.
Great. Okay. Well, I'm going to start wrapping us up because it looks like we're moving into the gratitude portion of our program this morning. Yes, I think the link we might be talking about is the recording. John's just posted that. And through the website, is where you would go to actually sign up. So first of all, let me take a moment to thank our partners again at KGA, Nicole and Megan. It's been great getting to know you, and thank you so much. This is very exciting. I keep learning about more services that are available through KGA. This is so exciting. And of course, Laura at Maine Community Foundation, please send our gratitude to your entire team for supporting this initial pilot. We're so grateful. Just a reminder, you can visit nonprofitmaine.org/EAP for more details and to sign up. Will be a recording of this program. The sign up form opens after this call. Space is limited to 300 employees in this pilot phase, which begins on March 1st. It is a first come, first served basis. Once eligibility has been verified, you can expect to hear from us by January 30th is when we will be doing follow-up so that you can find out whether or not we were able to enroll you in this go around. And as I said, we do hope to expand this in the future. Let me see. And let me see if there's anything else that we should mention. Oh, and also if you think you might be eligible, go ahead and sign up and we'll follow up if we have any questions before we finalize. So I know there are a couple of folks who had specific questions that we are unable to answer right now. So we'd advise you to go ahead and sign up and we'll do a follow-up to confirm eligibility. And if you have Megan and Nicole have been very generous in saying that they're happy to follow up with questions. I imagine right now it might be mostly about eligibility, and you'll want to steer those toward our team because again, this program is available because of economies of scale, because we'd be joining forces together to offer this as a Maine Association of Nonprofits program. We are going to be here to support you as well. And so if you have questions, don't hesitate to reach out to Ellis Ivy, our network engagement manager. I think, Ellis, if you haven't already, you might be willing to put your email in our, yes. Yeah, I'm trusting there you go. Ellis put his email in. And in the meantime, thank you again for joining. We are so delighted to be able to offer this program. And thanks again to our partners at Maine Community Foundation. I hope that you enjoy the rest of your day. Take good care.
Thank you, everyone. Take care.
Thanks, Nicole. Thanks, Megan.
Thank you.